Welcome to Politics West. And the devastating effects of long COVID and how it's affecting millions.
People are genuinely struggling, and I'm not making it up.
Now, most of us have now had COVID at least once, and many people lost their taste and smell. Imagine then if you're a chef and can't taste your own cooking. What do you do? And what if you're one of the unlucky ones who are left exhausted with long COVID for months and months? Some are calling for the condition to be classed as a disability. Here's Seb.
There are days when can't function at all, really.
Holly Pierce contracted COVID just a month before the vaccine rollout last year. Her symptoms were moderate, but the lasting effects involved severe fatigue, breathlessness and brain fog, leaving her unable to work as an NHS occupational therapist.
Sadly, it's not been possible to go back to work yet. I add the yet in a hopeful fashion, but honestly, it's not something that I can see as a light at the end of the tunnel at the moment. I still have that.
Although Holly's employers are supportive, her long-term options are bleak if she can't return to work, involving dismissal, retraining or early retirement.
Every day I feel like there's an element of me having to prove I'm still not well. If I have a day when I can do a little bit extra, that feels good, but also I'm scared because I feel like if people see I'm walking and talking okay, then why am I not fulfilling my role in society?
There are many people in the same situation as Holly who are struggling to return to work, while some can't even reveal that they have symptoms of long COVID in fear of losing their jobs. I've heard anecdotal evidence of chefs continuing to work in kitchens while having no sense of taste and smell, while others are taking action against their employer for not receiving enough support. There are now calls for long COVID to be classed as a disability, which would give sufferers more protection at work. But is that a realistic prospect?
I think over a period of time it will be established that long COVID is a disability. I think that will be, but it's not an automatic badge to say just because somebody has long COVID, you have to look at it on a case-by-case basis, and that's for medical people to come involved and establish whether they believe somebody is suffering with long COVID and the impact that has on their ability to live normally on a day-to-day basis.
It's thought that 1.7 million people now have the symptoms of long COVID, and it's unknown if that number will continue to rise. But some are already seeing an overlap with long COVID and the chronic fatigue caused by ME, which is now recognised as a disability.
As with ME, I think we've got a group who, especially if they have been ill for a year or more and have not made any significant degree of improvement, I think are fitting very much into the ME prognosis category, in that this is probably going to be a long-term chronic health condition.
With the country now marching to a post-pandemic beat, many are being left behind, unable to return to the home and working lives they remember.
Employers need to understand that people are genuinely struggling, and we're not making it up, and supporting people to do just a little bit of what they can, and perhaps increase what they do slowly at work will be helpful for some.
I hope you're feeling better soon. Well, Emma, I'm terribly sorry to hear that you have long COVID at the moment. What does that feel like?
Well, there are more than 200 different symptoms to long COVID, and for me personally, I've had long COVID since I got COVID in March of 2020, so it's a long time. I have the shortness of breath, I have the pulse rate and blood pressure that are all over the place. I have the various GI symptoms. I have lost my sense of smell and taste. I can't even tell the difference between coffee and tea.
Still after 2 years.
Yeah. And I sometimes lose my voice, which isn't great for an actress. And of course there's the fatigue, and fatigue is not the right word for it. It's I think a real misnomer. It's a kind of a system-wide cellular, it feels like complete just depletion. It's very debilitating.
And you were saying to me that after this program you might have to rest for some time.
Oh yes, there's the technical term for it, for the relapse is symptom exacerbation from exertion. And so what happens is that you put yourself out there, you push yourself to do something, and then you pay the price for it, the consequences, and you get into this awful cycle of push, crash. For me, I'm very lucky because I don't have young children. That would be a nightmare. I can't imagine how people cope with that.
Is it a disability in your view?
I think for some people with long COVID, absolutely it is,
Okay,
yes.
let's bring in Dr. Fox. You are a GP. Is this, in your view, a disability of long COVID?
Well, what's a disability in terms of the law is set out under the 2010 Equality Act, and it's defined as something over a long period that stops someone being able to carry out a normal life. And of course, as was pointed out in your film, we're still learning a lot about it. We don't know how many people ultimately will get better, how many of them won't get better. It reminds me a great deal, as was mentioned, of MEA. I was a GP at the time, and I think the most important thing of all that came to me from the film is to say to people that we believe you. We believe that these symptoms are real. Because at the time, if you remember, chronic fatigue syndrome, people were saying, oh, we're not really sure if it really exists as an entity. Let me tell you, I have patients, and it really exists as an entity. So I think that's the first thing. There are more and more cases coming through the system, through the tribunal system. I think that for some people, the likelihood is, looking back at some of these other areas, that a number of people will fall within the disability category. But I think it's impossible at the moment to quantify that because there's not the sort of the longitudinal data available.
Joanne, are employers, first of all, do they believe it, or do they think it's some sort of whiplash that people might be making it up? And what can you do to raise awareness?
It depends on the employers, and employers should, I think, as been said, if it has a long-term impact on your day-to-day activities, it's a disability. But I think what's really hitting home for us, and speaking to our members, particularly in care and in the health service, who have this condition, is the absolute terror of losing their jobs. We're in the middle of a cost of living crisis. If you are a care worker who has long COVID, you can't rely on the statutory sick pay because you will not be able to pay your bills. So people are facing potentially a lifetime condition, but also not being able to pay their bills and potentially losing their home. And those are absolutely terrifying stories. And this government is not doing anything like enough to be able to support those people after the pandemic that we've been through.
That post-viral syndromes were established by the ME community with a lot of hard work. They were finally convinced. You would have thought that the government would have anticipated that this virus would have these consequences. It's quite surprising to me that they didn't.
Yeah, I think the government does have some responsibility here for how it handled the COVID pandemic in the first place. More people got COVID than they needed to, and that inevitably has meant more people got long COVID than they needed to.
Lockdown wasn't, sort of a bed of roses either, was it?
No, of course not. But I think that there are some decisions that the government has made that have made the situation worse. I think the relaxation of rules. The Greens would have done that a bit more slowly. We would be still making free testing available. I think that's really important, and we wouldn't have been so quick to lift the rules on the wearing of masks in crowded public spaces, which I think is important for protecting people with compromised immune systems.
Okay, we have to leave it there. Thank you so much. Thank you. Well, thanks again to my guests. That's Emma Sams, Dr. Liam Fox, Carla Denyer and Joanne Kaye.